going on, world? I know y'all are probably like, where in the hell is Kevin? Well, let me tell you something. Hello. What's up? What's up, everybody? Y'all already know what the deal is. Today is Monday. Monday, fun day. What is this? January 22nd. Y'all already know what we're doing. We're doing NCLEX questions today. So, hey, y'all already know we ain't going nowhere. We ain't going nowhere until I get 1,000 likes and I get 100 people up in here. Test me if you want to. If you guys are new here, welcome. We're about to do NCLEX questions. I got them off nurseslabs.com. They're free sets of questions. So make sure you guys go over there and check them out. I need for y'all to smash that like button. I need for you to share. I need for you to follow. I promise you, if I don't get 1,000 likes, we ain't going nowhere. I promise you, we ain't going nowhere. I need 1,000 likes. I need 100 folks in here. Also, if I don't have 10,000 likes, by the time we get to question 10, I'm boycotting and, you know, peaceful protests around here. You know what I'm saying? So, of course, I want to know who you are, where you're from, and where you are at in your nursing journey. Also, if you're not a nurse, what are you doing here hanging out with us? A little bit about me. Been a nurse for 3.5 years. Worked in an ICU, worked in OR, worked in PACU. 16-year military veteran. I can say that now because I'm out. No more reserves time. And I failed my NCLEX 3 times, y'all. 3 times. And guess what? No part of me cares about what you think about that. You know what I'm saying? So, because that test doesn't determine what type of nurse that you're going to be. Only you can do that, even if there's safety involved. You see what I'm saying? So, welcome. Nicole says, I've been a nurse since 2000, CRNA 2008. Shout out to you, Miss Ma'am. Good afternoon. What's up? Is it Nika? What's up? Hello from New Hampshire. Shout out to you. All right. I took my NCLEX today after it rescheduled. Okay. What's up, Ebony? St. Louis repeat test takers. Shout out to all my repeat test takers. Hey, we got 80 something folks up in here. Oh, 90 something folks. 94. Okay. Shout out to St. Louis. What else? Yeah, there you go. What's up, Chloe? How are you? All right. Hey, we're almost there. And I'm about to turn this camera around. So, hey, y'all, remember, you guys got to share. You guys got to follow. That is the trifecta that TikTok needs, that I need. Aloha, Rose Ann. How are you? Y'all, we're going to be doing NCLEX questions. We do these every Monday, Wednesday, Friday, 5:30. Hey, first of all, if y'all ain't got a fanny pack, what are you really doing with your life? You know what I'm saying? If you ain't got a fanny pack, what are you really doing with your life? Hey, but here we go. Here's our questions. Connecticut and a repeat test taker. I'm glad that you're here. Shout out to the NY. Question number 1. A client with bacterial pneumonia is admitted to the pediatric unit. What would the nurse expect the admitting assessment to reveal? Is it high fever, non-productive cough, rhinitis, or vomiting and diarrhea? What are we thinking? Hey, so if you guys are new here, welcome. We're doing NCLEX questions. I got them off nurselabs.com. They're free sets of questions. You guys can go over there and check them out for yourself. Remember, participation is the key. If I don't have any participation, obviously, I'm just going to sit here and just talk to myself until somebody gives me the answer. So, shout out to y'all. What are we thinking? By the way, I'm going to put you guys on a timer because you guys take too long. And also, if you don't like the fact that I talk, then, you can go away. No part of me cares about that either. I'll give you guys 15 more seconds. 15 more seconds. All right. Appreciate all the likes and all the follows. There's a lot of y'all. If I don't get to them, I'm sorry. But here we go. Here's our answer in 3, 2. Oops. The lies I tell. There we go. And the answer is A. It's a high fever. If the child has bacterial pneumonia, a high fever is usually present. Increased temperature or fever with tachycardia and or chills and sweats is a major clinical finding. Physical findings also vary from patient to patient and mainly depend on the severity of lung consolidation, the type of organism, the extent of the infection, host factors, and existence or non-existence of pleural effusion. That is physiological integrity or physiological adaptation, which is the 3rd largest section on the NCLEX exam. Number 3 at 11 to 17%. All right. 11 to 17%. Hey, if you guys are new here, I will tell you what client needs section that it comes from and the percentage. They may be off by 1, 2, 100, but whatever. At least you know what size that it comes from. It says, when do you do your lives? Monday, Wednesday, Friday, 5:30. It says, I knew it was A and I'm not finished with school yet. That's okay. Here's the thing. This is all about practice. I don't care where you are in your nursing journey. Or if you're a pre-nursing student, I don't care if you've been a nurse since 2000 and a CRNA since 2008. All right. There's nothing wrong with getting into a habit. But here we go. Question number 2. The nurse is caring for a client admitted with epiglottitis. Remember, paint the picture. Because of the possibility of complete obstruction of the airway, which of the following should the nurse have available? Is it an, IV access supplies, a trach set, an IV fluid administration pump, or supplemental oxygen? What are we thinking? Ooh, somebody said something naughty and TikTok blocked them. Also, I want to know who you are, where you're from, where you are at in your nursing journey. Ladies and gentlemen, I need for you guys to like, share, and follow. Hey, I need more shares. If you're in nursing school right now and you haven't shared this to anybody, what are you doing? What are you doing with your life right now? I don't care if you don't like them. Let them be friends with me, okay? That's what I need. Don't be greedy. Somebody just said something, it was easy. Hey, I didn't ask you if it was easy. I just asked you to answer the question. That's it. I'm struggling with math, North Carolina, my first semester. Shout out to you, preparing for NCLEX. That's what I like to hear. Graduated in April. I love to hear it. Honolulu, what's up? Miss Rose, been an RN for 15 years, 8 as an OR and surge tech. Shout out to you. I was actually a surge tech for 13 years. Been deployed as a surge tech, so I know all about it. What's up, Amber? But our answer is B, a tracheostomy set for a child with epiglottitis and the possibility of complete obstruction of the airway. Emergency tracheostomy equipment should always be kept at the bedside. Prepare for intubation or tracheostomy. Anticipate the need of an artificial airway. An artificial airway is required to promote oxygenation and ventilation and prevent aspiration. That is part of safe and effective care environment, which is management of care. Okay? That is the section that it falls under, which management of care is the largest section on the NCLEX at 18 to 23%. So shout out to everybody who got that right. Remember, I don't care if you think it's easy, just answer the question. Remember, some people that are in here are pre-nursing students and they have no idea what we're talking about, but they're just trying to be a part of it. You know, they're trying to understand what they're getting themselves into. So we got to meet people where they are. What's up, Nurse Lolo? You wanted to update and iPad. Oh, that's what I'm talking about. Hey, right now, everybody needs to stop doing what they're doing. I mean, of course, keep answering, but everybody give Nurse Lolo all the love, the support. Congratulations. Welcome to the greatest shit show on earth, known as being a nurse, whether you're being RN or an LPN. If you have any piece of advice right now for anybody that's taking the NCLEX, what would it be? Here we go. Question number 3. A 25-year-old with Graves' disease is admitted to the unit. What would the nurse expect the admitting assessment to reveal? Bradycardia, decreased appetite, exophthalmos, or weight gain? What are we thinking? All right. Somebody said something. Let me go back. Everybody's screaming C at me. Congratulations. Y'all need to be congratulated. Oh, that was me. Sorry. I didn't realize it was students. Yeah. Is it Thibodeau? Oh, Nurse Thibodeau 77. I know how to say your name because I had a student. Her name was Thibodeau. That is very Louisiana. So shout out to you. Yes. So we have all different types of folks that are in here. All different types of folks in here. So one thing that we forget as nurses is that we forget that, you know, other people are eventually going to replace us. So we got to meet them where we are. It's kind of like being a preceptor where you get nursing students and you get new grads. You know what I mean? So shout out to Thibodeau. So I actually like your name. I used to call her Tibby all the time. So shout out to you. Here we go. And the answer is exophthalmos. Exophthalmos means protrusion of eyeballs, which often occurs with hyperglycemia, right? I'm sorry, hyperglycemia, hyperthyroidism. Sorry. All right. So Graves' orbitopathy is caused by inflammation, cellular proliferation, and increased growth of extraocular muscles and retroorbital connective and adipose tissue due to the actions of thyroid stimulating antibodies and cytokines released by cytotoxic T lymphocytes. That is a mouthful, ladies and gentlemen, and that is part of physiological integrity, physiological adaptation, which is the third largest section on the NCLEX exam. Tiffany says, I'm loving the 7-day NCLEX course. Ma'am, I'm glad that you love it. I'm putting a lot of work into that. We're getting some more things recorded and updated. So here within the next couple weeks, there's going to be anywhere from 5 to 20 videos that are going to be uploaded on there. Who's just told me next question? Devin, you know better. We don't do that around here. We don't rush me. All right. Here we go. Question number 4. The nurse is providing dietary instructions to the mother of an 8-year-old child diagnosed with celiac disease. Which of the following foods, if selected by the mother, would indicate her understanding of the dietary instructions? So what did the mom state? Which meal did the mom state that was correct in regards to the education we gave her? Is it a ham sandwich with whole wheat toast, spaghetti and meatballs, hamburger with ketchup, or a cheese omelet? What are we thinking? Shout out to all 300 plus of y'all in here rocking with me. Hey, we're on the road to 10,000 likes. If I don't get 10,000 likes, I'm shutting it down. Shutting it down. Also, I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? Everything else is bread. I don't go to nursing school. No gluten. What's up, Stacy, my favorite person? How are you? Missouri. Miss Red is up in here. I see you. 2 weeks, LPN student. All right. I love seeing y'all up in here. I love seeing y'all. You're prepping. That's what I said. Shout out to the NY. Arkansas. Shout out to y'all. Gluten-free. Michigan, former ICU. I love to hear it. Here we go, y'all. Here we go. Here's our answer in 3, 2. And the answer is cheese omelet. All right. It is a cheese omelet. The child with celiac disease should be on a gluten-free diet. I saw a bunch of people saying that in there. When a child has celiac disease, gluten causes the immune system to damage or destroy villi. Villi are the tiny finger-like tubules that line the small intestine. All right. That is part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. Taking boards on Wednesday. I know that's right, Ashley. But yeah, so there it is, ladies and gentlemen. Remember, when you guys are studying, you guys need content, you need Q&A, and you need your rationales. All right. Those are the 3 things that you need. There are no tricks to studying for the NCLEX. It's called putting in the fucking work. Like, if you want to come out here and you want to cheat, then maybe you'll just be a Florida or a Georgia nurse. I'm just playing. I don't mean that. Shout out to all my Florida and Georgia nurses. But here we go. Question number 5. The nurse is caring for an 80-year-old with chronic bronchitis. Upon the morning rounds, the nurse finds her O2 saturation at 76%. Which of the following actions should the nurse take first? Notify the healthcare provider or the physician, recheck the O2 sats levels in 15 minutes, apply O2 by mask, or assess the pulse. Hey, I don't mean no shade towards Florida and Georgia nurses. I was just kidding. Hey, but that Operation Nightingale, if y'all don't know about it, y'all need to read about it. Call the RT. That ain't even on here. That's a good answer though. That's a good answer. Good luck. When I was working ICU, our RTs were taking care of the whole damn hospital, and it took forever for them to get up there. So here we go. Shout out to all 800 plus of you guys. Make sure you guys like, share, and follow. That's the trifecta that TikTok needs. All right, here we go. Here's our answer in 3, 2. And the answer is apply oxygen by mask. Remember the ABCs, because it's easy as 1, 2, 3. When answering this question, administer oxygen first to increase the O2 saturation level. Provide humidified oxygen as ordered. Administering humidified oxygen prevents drying out of the airway, decreases convective moisture loss, and improves compliance, which is part of physiological adaptation, which is the 3rd largest section on the NCLEX, ladies and gentlemen, at 11 to 17%. Can't stand RTs? What you mean? Hey, first of all, I learned everything that I ever wanted to know about the vent from an RT, especially because I worked the 2nd wave of COVID. It was a monster. Hey, but ladies and gentlemen, I have some free testing tips that you guys can check out over at my website, thebootnurse.com. It's also linked in my bio as well. Hey, 42 pages of just deliciousness. Because, your boy got a fanny pack on, but, I'm going through some stuff for y'all. Y'all can go over there and check that out. Y'all get y'all some tips to help y'all conquer the NCLEX. All right, here we go. It says, thank you for the front line. Hey, appreciate it. Great voice, Kevin. Hey, this is what I like to do. Here we go. Question number 6. A Gravida 3 para 0 is admitted to the labor and delivery unit. The doctor performs an amiotomy. All right, paint the picture, right? Which observation would the nurse be expected to make after the amiotomy? Is it a fetal heart tone of 160 beats per minute, a moderate amount of straw-colored fluid, a small amount of greenish fluid, or a small segment of the umbilical cord? What are we thinking? Shout out to all 700 plus of y'all. Hey, we literally just had like a 1,000 people up in here. So shout out to y'all for all the shares and all the likes, all right? Hey, we're on the road to 20,000 likes. So make sure y'all get carpal tunnel for me. You know what I'm saying? Gabby, I see you in here answering. Gabby's a frequent flyer. So if you guys are in here, I always give you a shout out if you look familiar to me. So everybody's telling me B. All right, I'll give y'all 5 more seconds. Here we go. I take the NCLEX tomorrow. User 61. Hey, I'm going to give you 2 choices. Either I ban you or you leave, because I consider this to be cramming. And if you're cramming the day before you take your exam, you don't need to be doing that. You need to be relaxing, right? You need to be relaxing as much as possible. And I say that as much as possible because, it's better said than done, right? You know all the information. If you don't know it by now, you don't know it at all. And that's the realest shit that I'm going to tell you, okay? So go away. Either go away or I ban you, which one you want. And then come back on Wednesday and tell us how you did. All right, here we go. But the answer is B, a moderate amount of straw-colored fluid. And amniotomy is an artificial rupture of membranes, and normal amniotic fluid is straw-colored and odorless. It says, I relaxed the day before. I believe it helped. It does help. It does help 100%. A successful rupture of membranes most commonly is determined by the immediate return of amniotic fluid from the vagina. This fluid usually is clear and odorless. That is part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. It says about to get a message before. What you mean, Tess? I'm lost. Here we go. Question number 7. The client is admitted to the unit. A vaginal exam reveals that she is 2 centimeters dilated. Which of the following statements would the nurse expect her to make? We have a name picked out for the baby. I need to push when I have a contraction. I can't concentrate if anyone is touching me. When can I get my epidural? It says maternity is a lot on NCLEX. It depends. Remember, the NCLEX is a computer adaptive exam. So based off of how you answer your previous question will determine what your next question will be. And that all depends on you. Okay. So we're on the road to 20,000 likes. Make sure you guys get carpal tunnel right now. If you guys are in nursing school right now and you haven't shared this with your cohort, I don't care how you feel about them. You could hate them. But I know y'all are in those groups like Cahoots and all, and y'all are in Cahoots together. So I'm going to need for y'all to Kahoot that ass over there and share this link. Okay. I'm going to give y'all 10 more seconds. Everybody's screaming D at me, though. All right. All right. Appreciate all the follows. There's so many follows coming through. I can't even thank everybody. So here we go, y'all. But here's our answer. I'm closer to my test day Wednesday morning. Okay. I'll let this one slide. But here we go in 3, 2. And the answer is, when can I get my epidural? Dilation of 2 centimeters marks the end of the latent phase of labor. Hey, remember, there are differences between the phases and the stages of labor. You need to know the difference of the different phases and stages of labor. During the latent phase, the cervix dilates slowly to approximately 6 centimeters. The latent phase is generally considerably longer and less predictable with regard to the rate of cervical change than is observed in the active phase. A normal latent phase can last up to 20 hours and 14 hours, nulliparous and multiparous women, respectively, without being considered prolonged. There's also part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. Your voice is soothing. I appreciate that. It's because I was sick, because I got bronchitis. I don't got bronchitis. I usually just talk like this all the time, so it's all good. Here we go. But I appreciate your nice words. Here we go. Question number 8. The client is having fetal heart rates of 90 to 110 beats per minute during the contractions. The first action the nurse should take is what? Reposition the monitor, turn the client to her left side, ask the client to ambulate, or prepare the client for delivery. What are we thinking? Shout out to all y'all smashing that like button and sharing and following. I appreciate you. Also, one other thing, some people will come in here and say that these questions are easy, and they may be easy to you, but I have to meet everybody where they are. Okay. So some people are not a part of school yet. Some people are in the first semester of school and have never seen this. All right. So you have to be able to meet people where they are. Secondly, the whole point of me doing this is to keep you in a routine. I don't give a shit how easy they are, but it's to keep you in a routine. You want to know why? 5:30 Central Standard Time, that ass is here, right? See what I'm saying? Right? There you go. That's what I'm saying. Shout out to all y'all. But here we go. The correct answer is turn the client to her left side. Somebody said it. Somebody said give the answer. Hey, give the answer. Hey, don't come here rushing me. You see what I'm saying? You rush me, I promise you, I'm going to ban you. How often do I do these lives? Monday, Wednesday, Friday, 5:30. So everybody wants to know why. This is why it's important that you read your rationale. Somebody said lion, left side, IV, O2, notify. And if Pitocin is going, stop the Pitocin. Okay. The normal fetal heart rate is 120 to 160 beats per minute. 100 to 110 beats per minute is bradycardia for the baby. The first action would be to turn the client to a left side and apply oxygen. A slow heart rate or bradycardia may indicate the baby is not getting enough oxygen delivery to the brain. A fast heart rate or tachycardia may indicate oxygen deprivation. This is an acceptable range of acceleration and deceleration, or speeding up and slowing down, of fetal heart rates during contractions and labor. That is part of physiological adaptation, which is the third largest section on the NCLEX exam. right, at 11 to 17%. All right, so make sure you guys understand where these questions can lie. Once you understand the topics and the client needs, it's no new news. You know what I mean? So shout out to everybody in the second semester. Somebody says second attempt in a month and I'm scared. Ellie, if you're scared, go to church. Also, you're going to be scared taking your exam. It doesn't matter how many times you take it, but guess what? You're going to do it scared anyway. I call that getting off of your beach. All right. Thank you for what you do, my friend. V, I appreciate you. Thank you. Question number 9. In evaluating the effectiveness of IV Pitocin for a client with secondary dystocia, the nurse should expect what? A painless delivery, cervical effacement, infrequent contractions, or progressive cervical dilation. What are we thinking? Shout out to all 600 plus of you guys out here rocking with me. Hey, also, I'm going to do an Ask Me Anything. And it should be an Ask Me, certain things, because some of y'all be getting real personal. But I'm going to do an Ask Me Anything after I do these questions. So you guys hang out. You guys can ask me questions about nursing, NCLEX, first year nurses, all that good jazz. All right. Here we go. Everybody screaming D. Everybody screaming D at me. Throw some D's on it. All right, here we go. Here's our answer in 3, 2. And the answer is D, progressive cervical dilation. The expected effect of Pitocin is cervical dilation. Oxytocin is indicated and approved by the FDA for 2 specific time frames in the obstetric world, antepartum and postpartum. In the antepartum period, exogenous oxytocin is FDA approved for strengthening uterine contractions with the aim of successful vaginal delivery of the fetus. That is physiological integrity or physiological adaptation. Same thing, 11 to 17%, making it the 3rd largest section on the NCLEX. Okay. Hey, listen, top 3 sections: management of care, pharmacological and parenteral therapies, and physiological adaptation make up 44 to 49% of the NCLEX. Okay. It says, oh my God, if I had someone read this during my test, I would pass. Look, hey, you can, if you want to record my voice and, take it along with you, you can do that. It's weird, but you could do that. Question number 10, a vaginal exam reveals a footling breech presentation. The nurse should take which of the following actions at this time? Anticipate the need for a cesarean section, apply the fetal heart monitor, place the client in the genopectoral position, or perform a ultrasound examination. What are we thinking? What are we thinking? Remember, ladies and gentlemen, when you guys are studying, you need content. I don't care what you say. There's no ifs, ands, or buts about it. How can you apply what you don't know to a question? You see what I'm saying? So this is why you have to study. You have to get into a routine. Okay. So you need content, you need Q&A, and you need rationale. The rationale solidifies what you have learned from your content and what you have applied in your question. When you do your rationale, that is how you are able to retain the information, whether you got it right or you got it wrong. Okay, but here we go. Let us see what the answer is in 3, 2, and the answer is B, apply the fetal heart monitor. Now, I know y'all about to be mad. Some of y'all about to be mad, but this is why it is important that you read your rationale. So let's read it. Applying a fetal heart monitor is the correct action at this time. Okay. Fetal heart sounds are heard high in the abdomen in breech presentation. Be certain to monitor the fetal heart rate and uterine contractions continuously to detect fetal distress early and provide prompt intervention. That is part of physiological adaptation or integrity at 11 to 17%. So I wanted to let you guys know that client needs have categories and subcategories, and there are a lot of them. Okay. There are a lot of them. And physiological adaptation consists of acute and chronic and trauma types of disease processes. So that's what physiological adaptation is really all about.